Hi guys, I'm Shubham Verma. The story I'm going to tell you guys is not an ordinary story. This is a story of hope and survival. This is a story about my dad who was diagnosed with COVID-19 on 6th of April, and he was in hospital for almost 2 months. The reason we want to make this video is to share our experiences about what all we have gone through, so that the people who might be going through this similar kind of situation, it's useful for them. It becomes a reference for them, because when we were in this situation, we were looking for people who had gone through the same kind of situation, and we wanted to talk to them, but we couldn't find many such people, and that's why we want to take this privilege to share our experience with you guys about the COVID-19. These are difficult times. Everyone, all of us are, like fighting hard to survive, to take care of ourselves and our family. There are more than 170 million cases in the world, like 30 million more than 28 million cases alone in India, and this is really a difficult time. But we all have to fight hard in these times. So let me tell you guys how it all began. So it began with my father having he started having few symptoms, like he started having stomach ache and fever for a couple of days. Then we thought initially we thought it might be because of some other problem. Then after few days, he was tested positive for COVID. And then after a couple of days, since his saturation was dropping, it was in and around 90 and less than 90% SpO2. So we thought, why not go to the hospital and why to take risk? So we went to the hospital, and he was hospitalized on 6th of April. So let me start off with telling you how it all started. So my father started having symptoms like fever and stomach ache in the beginning. And along with him, even my mother and my brother, they were having fever and few other symptoms. Then everyone in my family, they got tested positive for COVID, including my father, my mother, my brother, and my grandmother. I wasn't in India at that time. I was in US. I'm doing my graduate studies in US, and after that, after a couple of days of being tested, we thought we might take precautions at home, and they might recover. But my father's oxygen saturation started dropping less than 90. Then we took a decision to move him to the hospital on 6th of April. So he was admitted in hospital on 6th of April, and since then he was in hospital till day before yesterday, when we moved him home finally. Now I'm going to share you the story about what all happened in the hospital, because I'm sure that there are people who might be going through a similar situation, and hearing us talking about our experience and the things we have gone through might be helpful to them. It might give them hope, and it might give them idea about what are different process and what a person goes through. So initially, when my father was admitted to hospital, he was kept in the emergency ward for 1 day. So he was put on 2 liters of oxygen. Everything was fine. Then the day he was admitted, all different kinds of scans were done, especially the HRCT scan was done, and doctors said that his lung was already 50% affected due to COVID, because we already it was already a week he was infected, and so his lungs were 50% affected with COVID. So initially he was on 2 liters oxygen. Then as the days progressed, he went from 2 liters to 4 liters to 8 liters to 15 liters oxygen. So now what happens is that when a person requires 15 liters of oxygen, after that doctors, they would suggest you to move the person to ICU. So after almost 10 days in a hospital, doctors said that he needs to move to the ICU. So it was a very difficult situation for my family because at that time I was in US. I couldn't come immediately. Like I was hoping my father might recover soon. Like even in ICU, like people like would spend a couple of days in ICU and then they would come back, and like that's what I was hoping. And my brother was the only one here taking care of my dad. Like I was there in US. I used to call them day and night. I was all worried about my family, like with the hope that my father would recover in a couple of days. But my father's condition kept deteriorating. Like his lung kept like getting affected more and more. Like from day one, doctors started giving him remdesivir. They gave him 6 shots of remdesivir. So usually they would give 2 shots of remdesivir on day one, and then each shot as the day progresses in hospital. So he was given 6 shots of remdesivir. There was no problem with that. So before putting him on ICU, they also asked us to bring plasma, and somehow my brother arranged plasma in Hyderabad, India. And like when after giving plasma, I think my father kind of had reaction. Usually plasma do not react to your body, but like it's an external, like blood thing which is being put in your body. So after he was given plasma, my father started having chest pain, and all night he had chest pain, and all the doctors were present at that time throughout the night. It was a very difficult scenario. It was a very difficult situation for my brother and for our entire family who was going through this. But somehow we passed through that day, and we were hoping that at least the remdesivir or the plasma would be helpful, but apparently that did not help. Like my father, after 10-15 days, when another CT scan was taken, it was found that my father's lung was affected more than 90%. And after almost 10 to 15 days of hospitalization, when he was requiring 15 liters of oxygen, doctors suggested that we move him to the ICU. So we moved him to ICU, and in ICU he was put on the NIV mask. So NIV stands for non-invasive ventilator. So it's a ventilator, but it's non-invasive ventilator. So there will be a mask which doctor will put. It's called non-invasive ventilator. Now what doctors do is that they would try the patient to put him on the non-invasive ventilator for some time, and then on the normal oxygen, and they would keep doing it to check if the patient is maintaining his saturation, like by removing the non-invasive ventilator. But for my dad, like it did not happen. Like his health kept deteriorating, and after one day of the trial, like he was put on the NIV mask for the entire day. And usually NIV is a very uncomfortable mask. It sits tightly on your nose and mouth, and it's very uncomfortable. Like the patient is already in the hospital for like 15 days. He hasn't eaten a lot of food and all that, and there's a mask. So it becomes very uncomfortable for a person to put that mask. And sometimes for some people NIV helps, they recover with the NIV. But if your lungs are more than 90% affected, and if you are really affected with COVID, like even NIV doesn't help. So in such scenario, doctors would suggest for putting him on ventilator, like putting him with the invasive ventilator. It's called intubation. So doctors said, asked my brother if they can intubate my father. So intubation means they would be putting pipe through his mouth and use the ventilator to support his lungs and oxygen level. And we had no other choice. Everyone was confused what to do and all that. My father was really uncomfortable with the NIV mask, so we had to take the hard decision to put him on the ventilator. So when a person is put on ventilator, he has to be given heavy sedatives, because the pipes which go through your mouth, they are really uncomfortable. And if you are not given heavy sedative, you are usually like you would attempt to remove the pipes, the ventilator pipes. the intubation pipes. So my father was put on ventilator on 18th of April. That's like the day before he was put on ventilator, I already started from US. I couldn't speak to my brother while he was making the decision to put him on the ventilator. I was on the plane, and the day I came here, I arrived in India on 18th of April, and he was already on ventilator. On ventilator, a person cannot speak. He is on heavy sedative. So people whose whose family member might be going through the same situation, I think putting on ventilator is not the worst idea. But like once the patient goes on ventilator, usually doctors would say that it's very risky. So after he was put on ventilator, doctors started doing their procedure. They started giving him a heavy dose of antibiotics, steroids. They have already given him remdesivir and plasma. And every day we used to have counseling. Every day we used to meet with doctors, and all the doctors for every day they used to tell us that there is less than 10% or 5% chances of survival of my dad. Like for straight 15 to 20 days, every day doctors used to tell us that there is less than 10% chances of the survival. Like you guys can imagine how dreadful and how fearful those days for all of us were. Like this is a kind of situation where even your family members, your extended family, cannot come and visit you and comfort you. So we were only two people, and my mother, like me, my brother and my mother. We were the people who were taking care of our dad constantly. And all our extended family members, they were supporting us, but they couldn't visit us in person. This is understandable because like many places in India were having lockdowns. People were not allowed to travel and all that. But there were a lot of times we felt helpless. We felt we felt like giving up, but there's no option of giving up. There is someone who is still breathing, and you want to do everything possible in your hand to for the survival of that person. Like he's my father. For my mother, he's a husband. So we had no other option than to keep hoping. Even when doctors used to tell us that there is no hope, there is only 10% chances of survival, we still kept our hope high. We still did not give up. Every other day we used to visit ICU unit, and we used to watch someone or the other person dying there. I myself, I might have seen more than 10 deaths through this span of my visiting hospital. My brother, he says he has seen more than 20 deaths in front of him. We have seen younger people in their early 30s dying, people in their late 60s dying, all kinds of people. And it was really painful. It was really I don't know, I never imagined I would go through such kind of situation. My family would go through such kind of situation. Even last year, when when coronavirus hit the world for the first time, I asked my family to be very careful, and I was sure that nothing is going to happen to my family, because they are being very careful. But you don't know when something is going to happen. One has to be ready for everything in life at the end. My father always used to tell, you have to be ready for everything in life. Things don't knock on your door by warning you whether it's good or bad. You have to be ready for everything. That's at the end, that's what life is. Two things which helped us to survive this time. One, hope. Never lose hope. As long as the person is breathing, there is hope for his survival. Second, do not give up. There's no giving up. There's no choice. You don't have to give up. For me, for my brother, for me, for my mom, did we have a choice? We didn't have a choice. There is only one thing. Keep doing what you are doing. Keep hoping that he he's going to recover, he's going to stand on his legs one day. That's it. That's all you want to do. And so basically, like so he was put on ventilator. So when, like as I already told, when a person goes on ventilator, he's on heavy sedative. He cannot talk to you, you cannot talk to him. Doctors might say that like the person might be able to hear you, but I asked my dad if he was able to hear us. No, he's not able to hear us. He's in deep sleep. He might be dreaming, he might be having a lot of dreams or not, but he is in deep sleep. So he was on ventilator, like he was on they intubated him for like 10 days. And after 10 days, the usual procedure is that what happens is that the tubes which are going through your mouth, they might cause some infection. So doctors would suggest you to do tracheostomy. So tracheostomy is basically they would do a small hole in your neck here, and they would put the pipe, the oxygen through your like through the hole. That's called the tracheostomy. So doctors suggested us that like we should go ahead and like they should be doing tracheostomy for dad, and they need permission for this. So I inquired with various doctors, like is it a safe option, and if any patient is in ICU and he is on ventilator through the intubation, tracheostomy is the safest option, because there are chances of secondary infection and like which might worsen the person's situation. So after on 11th day of ICU or in ventilator, my dad was put on tracheostomy. So tracheostomy is like pretty easy. Like they can, like why doctors prefer tracheostomy. So it doesn't cause any infection, first of all, and second, it's very easy to remove the ventilator and put him on oxygen for trial basis. So like once he was put him on oxygen, the doctors, they started trying him to put him on the normal oxygen. So ventilator is a different machine, and then like there's a normal oxygen, medical oxygen support. So you can just remove the tube, put him on the medical oxygen. And like when a person is put on like when you do the tracheostomy, doctors usually stop giving sedatives. So after like couple of hours, patient would wake up. In the situation of like for my dad's situation, what happened is that he did not wake up very soon. So it took him like 2 to 3 days to fully become conscious after the sedatives were stopped. We were really worried about him. Like we thought, what happened? Is his brain not functioning? We asked doctor to take MRI scan and all different things. So MRI scanning was good, his heart was good, his kidneys were okay, everything was good. Like we still don't know why it took him so much time, maybe because of weakness. But like finally after 2-3 days, he started becoming conscious. Like he wasn't fully conscious. It took him more like 10 to 15 days to become fully conscious. But he was kind of opening his eyes, trying to see us and understand what we were trying to say. He couldn't speak because the tracheostomy is basically the tube is inserted in your windpipe. So you won't be able to speak when you have the tracheostomy tube in your neck. There's nothing to worry about. Okay, tracheostomy I think is a very safe option, and people like who are in the similar situation, if your doctor tells you to put tracheostomy, do not be afraid. Then after that, like my father started becoming conscious little bit day by day, and doctors started like trying normal oxygen. And then like my father, we started seeing positive improvement in him. He was still like on and off the ventilator most of the time, but doctors started doing the prone position and making him sit on the chair on the side of the hospital bed. They started like mobilizing him so that like his tissues become like active and he starts breathing effectively. And after around 1.5 months, I would say, he came down, his oxygen like requirement came down to around 4 to 5 liters. And then it was like for a couple of days, like it was 2 liters. At that time we thought, like, doctors also suggested us, like, like, why don't we try rehab. So, like, already we were paying so much money in the hospital. Like, we were in a private hospital in Hyderabad, in India. And unfortunately, like, because my family never had any medical issue, so we did not have medical insurance. So what all we were paying from day one, we have been paying out of pocket. And since both of us, like, I'm also a student, my brother is also a student, like, my father was the only earner in our family, like it was becoming a real financial burden. So because of that, we thought, why not move our father in rehab, because he's requiring around 2 to 3 liters of oxygen. And like, he needs a lot of rehab care, because he after 1.5 months he got tested negative for COVID, first of all. And then, like, he did not have any other problem other than lung dysfunction. And he had a lot of muscle weakness, so that's basically the post ICU weakness. So usually rehab is the best option for such kind of situation, because in rehab they would do like aggressive physiotherapy, there will be a nutrition care, and there will be a team of doctors and nurses who will be taking care of the patient and making sure that the patient recovers, like, faster than, like, he would do in a hospital. So one fine day, like, after 1.5 months, on I guess on it was on 11th of May, we moved our father from the hospital to the rehab, in one of the rehabs in Hyderabad. And we thought, like, oh, like, he's gonna have a speedy recovery after we move him to the rehab. But after going to rehab, he again started having, like, respiratory problem. His respiration rate started dropping down. And the people in rehab, so rehabs usually do not have ventilator facility. So I would say, if a person requires ventilator, and if you need to move him to rehab, do not do that. Like, for my dad, he was not requiring ventilator for a couple of days, that's why we moved him to rehab. But suddenly he started, like, he required ventilator. And at that time, like, the situation was so bad that we couldn't find the hospital bed somehow. Like, all day we were somehow managing him, managing, like, his oxygen using the normal, like, medical oxygen. We were managing his respiration rate. And finally, at the end of the day, like, we spoke to our doctor, and he managed a hospital bed, like a ventilator bed, in the same hospital. So within 24 hours we had to move him back to the same hospital. And again, the same story repeated. He was in emergency, then he was put him in the ICU, then he was put him on the ventilator, and the same story. Like, again, for a couple of days he was on ventilator. But this time, like, most of the things, like, the biggest hurdle has been passed. Like, so, like, he's on the way to recovery. So after that, he was on ventilator, he was on and off the ventilator. So, like, he needed ventilator for, like, a couple of hours in a day, but most of the time he was on oxygen. The main reason he needed ventilator is because he had a lot of respiratory muscle weakness. And because of that, he was retaining carbon dioxide in his body. He was unable to exhale carbon dioxide. And that's why he needed minimum ventilator support for good, like, 10 to 15 days after he was readmitted in the same hospital. And then after that, like, after, like, 10-15 days, slowly he started maintaining his carbon dioxide as well, because his fatigue started improving, his muscle weakness started lowering down, and, like, he started breathing by himself. Like, meanwhile, we did a lot of mobilization. Like, I would suggest you guys, like, whoever is taking care of COVID patient, please do not leave everything on doctors. Like, already, like, there is a lack of staff and doctors in India, like, in hospitals usually. And, like, they cannot literally, like, give attention to one patient. It's not their fault. we have to do our own duty. Like, we have to be really active in taking care of our own relative, our own patient. So like we used to take care of our dad. We used to go and feed him like 3 times a day. Like me and my brother, we ourselves used to like do we learned how to do some physiotherapy, and we used to make him do exercises and stuff. So I would really urge, like, whoever is taking care of any COVID patient to not leave everything on doctors. Please, like, help your relatives yourself. Like, do your own part, because that will ensure a speedy recovery and a positive recovery. And finally, like, yeah, like, a week ago, my dad, he started, like, his oxygen requirements started lowering down. And like 4 5 days ago, I asked doctor if he can remove the tracheostomy tube, because he was requiring hardly 1 or 2 liters of oxygen. So doctor finally decided to remove the tracheostomy tube, and like as soon as he removed the tracheostomy tube, my father could speak. Okay, like, one thing I would like to tell you guys, like, before like the tracheostomy tube was removed, I used to ask my father to, like, although he couldn't speak, but a patient can always make noises, like he can make such kind of noise. So I used to tell my dad, oh yeah, like, make such kind of noises, or like do the chewing. Like, just imagine there is something in your mouth, like chew, like, you have to, like, so usually, like, if a patient is in ICU and is on ventilator for more than a month, like, lot of other complications might come up. He might have to go through like, a breathing, like, swallow therapy, chewing therapy, and like, memory loss and all that. So for my father, nothing happened, because we have been very active. My mother, my brother, and myself, we have been very active. We have been actively talking to him. We have been actively asking him to do all kinds of exercises and like stuff. So it's very important that we ourselves do our part. Also remember, like, people whose relatives are like, are in ICU and are going through the same kind of situation. Please make sure that you are bringing alpha bed early on. Lot of patients, they develop bed sore. So in order to make sure that your relative do not develop a bed sore, make sure that you bring the alpha bed, or ask the hospital to put him on the alpha bed from the beginning, because bed sore is another kind of problem which you have to deal with once the patient comes out of ICU. And finally, like, the tracheostomy tube for my father was removed, and after a couple of days after the removal of the tracheostomy tube, like, as soon as the tracheostomy tube was removed, he could speak, he could eat. We started feeding him through his mouth, and after a couple of days, doctors said that we can like, discharge him, and that's what we did. Like, day before yesterday, we discharged my father. He was admitted on 6th of April and he was discharged on 4th of June. So almost 2 months in ICU, complete ICU. But finally, like, we thought, like, rather than taking him to rehab, we should bring him home. Right now, he's requiring only 1 liter of oxygen. So we have purchased oxygen concentrator, a 5 liter oxygen concentrator, and we are taking care of my father at home. He still has lot of muscle weakness, a lot of muscle fatigue, but he's recovering. He's on the way of positive recovering. He's talking to us. The home environment is very good for a patient. So rather than taking your patient to a rehab, if you are capable of taking care of the person, then why not bring him home? That's what we did. So right now my father is on the way of his recovery, and hopefully, like, within couple of weeks, I would say, he would be able to stand on his own leg, and like, he will be able to walk and do his normal function. So I hope this story is helpful for the people who are going through the similar kind of situation. And if even if you are not going through similar kind of situation, never give up in life, in any kind of situation. First of all, be ready for anything. Never give up and have hope. Keep hope. Like, we are living with hope. At the end, that's what is there to live with, hope. And at the end, I really want to thank all the people who helped us in every way possible. Like, I cannot imagine how many people they came forward to like support us, help us. Like, there were people I did not speak to for years. Even they showed up and helped, like, in some or the other way. I really want to thank each and everyone. I want to thank the medical community. I want to thank, like, doctors are real hero in these times. My mother, my brother, they are the real hero in this time. Like, because of them, because of everyone like coming together as a humanity, if, for the sake of humanity, this is like we could bring our father home. So thank you very much, guys, and I hope this video is going to be helpful to everyone. Thank you.